Planned Parenthood will tell you it's safer than Tylenol. Welcome to Freedom Alive. Dr. William Lile is board certified in obstetrics and gynecology. He's known as the pro-life doc. Abigail Forman is a researcher and policy analyst with Liberty Counsel Action. Both join us to discuss chemical abortions and the harms to not only women, but to every person who consumes water. I'm blessed to again be joined by my friend and co-host Matt Staver from Liberty Counsel. And Matt, the vast majority of the approximately 1 million abortions that occur each year in the U.S. are now performed outside of a clinical setting. That's nearly 2 in every 3, but likely even higher than that.
The numbers are astounding, Steve, and they continue to grow. Even though brick and mortar abortion facilities are closing, abortions are increasing because of these chemical abortions, and they're very dangerous to women. So Dr. Lile is going to join us, and he's going to talk to us about the harms and the information that the FDA has been concealing from the public in terms of how these pills are harming women, let alone obviously killing children. And then Abigail Forman with Liberty Counsel Action is going to talk about how these chemicals and the remains of these aborted babies are entering our water supply system, and that's how it affects every person, because these are not filtered out of our water supply systems, and they could well be in our drinking water.
Amen. It's great to have Dr. Lile back, as well as Abigail back on Freedom Alive. We cannot wait to tackle this issue. It is so important. But Liberty Counsel's Freedom Alert is next.
Colorado forces colleges to sell abortion pills. Governor Gerald Polis signed legislation forcing Colorado's public colleges and universities to sell abortion pills at student health centers. Under the new law, public institutions operating student health centers must provide students access to mifepristone and misoprostol. Campuses with on-site pharmacies are also required to stock the drugs for students. An April 2025 study from the Ethics and Public Policy Center found that nearly 11% of women who take mifepristone experience serious adverse health events, including sepsis, infection, hemorrhage, need for blood transfusion, hospitalization, emergency room visits related to the abortion, surgery due to incomplete abortion, and other abortion-specific complications. Chemical abortions harm women and kill children.
Up next, Matt's interview with Dr. William Lile and Abigail Forman.
It's my pleasure to welcome to Freedom Alive Dr. William Lile, a board-certified obstetrician and gynecologist who's been on this program before, and also Abigail Forman, who is a public policy analyst and copywriter for Liberty Counsel Action. Welcome to Freedom Alive.
Thank you very much.
Yeah, thank you for having us.
Dr. Lile, let's begin with you. Your specialty is obstetrician and gynecology, and you're board certified in the area, and also emergency medicine in that particular area. We want to talk about the abortion pill mifepristone and its protocol and the statistics that you see as compared to what the FDA is revealing to the public, specifically with regards to harms toward women.
Sure. Well, the abortion pill is now the #1 form of abortion here in the United States. It's been available for about 20 years. It's replaced the presence of the surgical abortions, and it's been replaced with a pill. And probably at least 70% of all the abortions in the United States are performed with the abortion pill. And now it's available mail order without even a physical exam or an ultrasound. And when we were told by the FDA, when it was originally approved, we could expect a complication rate of less than 0.5%, but a large study, actually 28 times larger than all the studies that led to the approval of the abortion pill. This large study of 865,000 women showed that the complication rate was not less than 0.5%. It was actually 10.93%, 22 times higher than what we had been told. I mean, these included 40,000 women who had to go to the ER, 28,000 women who were hemorrhaging, 24,000 women who had to have an additional surgery, 12,000 women who needed to be treated for either an infection or sepsis, and 3,000 women who had to be treated for a life-threatening ectopic or tubal pregnancy, which is still the #1 pregnancy-related cause of death of women in the first trimester of pregnancy. So 22 times, not 22%, 22 times more dangerous. And yes, it was approved by the FDA, but we've had other drugs that were approved by the FDA. Vioxx, thalidomide, DES were all approved. And then a few years later, when we saw they were dangerous, then they were pulled off the market. The same thing needs to be done with the abortion pill. Women deserve better than the abortion pill. It is not health care.
So in the area of ectopic tubal pregnancy, that's the #1 leading cause of death, particularly in this particular area. But what other ways is this pill harming women?
Well, and if they have retained products, a lot of these women, in fact, 24,000 of these women had to have an additional surgery where they had a baby on the inside, the baby died, but then the baby was retained on the inside and they did not pass it, so they had to have a D&C. But then a lot of times that all the material and all the tissue, the placenta, the fetal tissue is not passed, and that can lead to an infection. And there were actually over 12,000 women who had to be treated for either an infection or actually life-threatening sepsis. So there are a lot of complications, especially when a woman really doesn't know how far along she is, because between 25 and 35% of women, when they're asked, what was the first day of your last menstrual period, will be off by at least 4 weeks. So if a woman thinks that she's 12 weeks pregnant, there's about a 25 to 35% chance that she might be 16 weeks pregnant. And a lot of these women think they're just going to have a little bit of bleeding, a little bit of cramping, and maybe pass some tissue. But sadly, a lot of these women are passing what they can visually see is a baby fully developed with eyes, fingers, fingerprints, toe prints, and they're coming to pregnancy resource centers and even emergency centers when these babies in their hands saying, I don't know what to do with this baby, and I did not know what the abortion pill was. But lots of complications, and these are the physical complications. But we also have the psychological and emotional trauma that these women are going through because, yes, they are having severe pain and cramping and bleeding and then passing a baby that they can identify. And it's a horrible process, and the majority of these women are doing this alone. There's no family, there's no friends, there's no coworker that's there to work them through. They are sharing this trauma themselves, and a lot of them need counseling afterwards.
That's a good segue to Abigail Forman. You have done an amazing research project with Liberty Counsel Action, Abortion in Our Water, and there's also an abortioninourwater.org website. Pick up where Dr. Lile left off about what's happening here, where women are seeing some of these abortions actually, because they're not occurring in brick and mortar facilities anymore. These chemical abortions are appearing in the homes or hotels, and they're actually being flushed down the toilet.
That's right. And it's quite tragic. And as Dr. Lile said, it's traumatizing to these women. You know, there were over 2,000 women recently that signed on to an amicus brief to the Supreme Court on this issue, saying this pill harmed me. And if you read the stories, they're really horrific of these women being traumatized because they're often told by abortion providers to just sit on the toilet during their chemical abortion and flush. You know, sometimes they might keep the baby, but very often these babies are being flushed down the toilet. The woman freezes. She doesn't know what to do. There's a baby in the toilet, and so she flushes it. And this actually, in addition to just being awful, right? So we're killing babies, we're harming women. Now we're also contaminating our water supply because you're flushing a chemically tainted placenta, baby, fetal tissue, all of the blood, et cetera. You're flushing that chemically tainted waste into the wastewater systems all over America. You know, Dr. Lile said, I think it was something like 700,000, probably more, aborted babies from chemical abortion occur annually being flushed into our wastewater systems. And this contaminates our water in two different ways. So the first way it contaminates our water is through chemical contamination. So Mifepristone itself, the first of the 2 pills in the chemical abortion pill protocol, works by cutting off progesterone, so that progesterone is a vital fertility hormone. It helps the baby develop and get nutrients. So if you cut it off, the baby starves. And mifepristone, when a woman takes it, forms active metabolites in her body. These active metabolites retain the ability of blocking progesterone. Okay, so we have active progesterone blocking contaminants being flushed because women excrete them in their urine, in their feces, and in the blood, placenta, etc., that are flushed down the toilet. Traditional wastewater systems are not designed to remove this sort of contamination. These chemical compounds remain active. Then after they go through wastewater systems, they go into your local lakes, streams, rivers. Then a drinking water treatment plant gets them. Drinking water treatment plants are also not designed to fully remove pharmaceutical contamination. We know other pharmaceuticals are in our water. The U.S. Geological Survey and the EPA did a joint study finding over 26 pharmaceuticals in our water. We know as well mifepristone itself has been found globally in China, in Switzerland, in rivers in Switzerland. And then actually a 2024 research study on mifepristone found, and this is a scientific journal, this is not me saying this, it said mifepristone contamination in the aquatic environment is growing to be one of the most alarming public health concerns. This is 2024. Again, this is not a pro-life journal. This is a scientific research journal saying mifepristone is growing to be an alarming health hazard in our water because it retains the ability to block progesterone. Well, progesterone is a vital fertility hormone. Men need it, women need it, wildlife need it for effective reproduction. And if you're blocking it, what could that be doing if we're ingesting trace amounts of this? Now, we don't know for certain how much we could be ingesting, but what we do need to say is this could be happening and we need to be studying it. Because if we are ingesting trace amounts of something that is blocking a vital fertility hormone, that is a crisis and we need to be addressing it. Now, that's the first way chemical abortion contaminates our water. The second way, as Dr. Lile mentioned, is the biological contamination. And this part is really hard to talk about. It's graphic, it's tragic, but you have the baby itself, cranial structures, limbs, etc., the placenta, the blood, all of this from the chemical abortion is being flushed into the wastewater system. Well, again, wastewater treatment plants are not designed to deal with this sort of biological waste. We have morgues and medical waste facilities for that purpose. But if women are being told to just flush it, then we see babies that are at 10 weeks, that's 1 inch in size. At 12 weeks, that's 2 inches in size. And as Dr. Lile said, we're probably seeing 16, 18, 19, 20. You don't know. We're probably seeing aborted babies of any gestation because women often don't know their gestation. They don't remember their last menstrual period. And so at any rate, you have fetuses that are, we'll just say at least 1 inch, if not, 2, 3, 4 inches in size going into the toilet. That's big enough to clog a pipe. Well, if you're clogging pipes, you're causing sewer backups and sewage overflows. And this is another environmental hazard. And this is actually quite tragic. We've seen reports. There was a report actually out of Houston, Texas, of residents who had experienced sewage backups, and a plumber came out and found a baby in the pipes. Okay. This is happening all over the United States. We see multiple reports of babies found in wastewater treatment plants, which, by the way, has the side effect of traumatizing the wastewater treatment plant workers who find them. So the effects of chemical abortion not only kill a baby and harm women, but they contaminate our water. It affects all of us, and we need to be bringing this to the attention. And we actually are. Liberty Counsel Action is doing a lot to try and bring this to the attention of the White House, the Congress, agencies, EPA, FDA, because we need to, as Dr. Lile said, ultimately we need to take this pill off the market.
That's unbelievable. It's not only harming women, it's killing children, but it can be affecting the entire environment, including even our own drinking water. And certainly none of this was considered, Dr. Lile, by the FDA when they rushed this through approval in 2000. They didn't consider or didn't want to consider the fact that this was going to be the biggest aspect of abortion, or where these abortions were going to take place, and it's actually going into our wastewater, our drinking water, perhaps, systems. This is unbelievable and tragic. I know you are in this area on a daily basis. You've actually counseled women who have taken this pill, and they've had regrets, and you have been able to provide an abortion pill reversal protocol. Talk about how that's available for women who may have taken this, then they decide they made a mistake, and they want to change and not have this abortion.
Absolutely. Well, we all have made decisions that we regret, whether it's things that we say or things that we do. And we're seeing more and more women who feel very pressured. And some of these women are actually forced to take the abortion pill or even are slipped the abortion pill as a weapon. But we all have regrets. And when a woman has a regret where she might have walked in and says, nobody loves me, nobody's here to help me, I don't know what to do, the abortion pill will help. And then we have so many women who haven't even gotten back to their car that have regrets. Well, we have a hotline. There's a toll-free number that can be contacted through abortionpillreversal.com. And you will meet one of our counselors, and they will put you in contact with over 1,000 physicians that are in all 50 states who will take your information, take your health record, your allergies, and they can prescribe you a medicine called Prometrium. The abortion pill works by blocking the hormone progesterone, just like we had just heard from Abigail. Well, what is progesterone? Progesterone is the progestational steroid hormone. That's where they got the word progesterone. It keeps a pregnancy going. The abortion pill blocks that hormone called progesterone. Well, how do we reverse it? We just add progesterone. So the abortion pill made the hormone levels go down. Mom has regrets, and we can bring those hormone levels up. And we use progesterone in normal obstetrics all the time. It is bioidentical to what the mother's body is producing anyway. We use it to prevent miscarriage. We use it to prevent preterm labor. We give it to our triplets and quadruplets. And I've delivered trips and quads, and they all had progesterone given to them. And it is the exact same hormone that the body produces. We have now documented over 8,000 successful reversals of the abortion pill after it's been taken. Now, we have about a 72-hour window where we can actually safely reverse the effect of the abortion pill, and we have absolutely no evidence whatsoever that there is any teratogenic effect on the baby or any harm from being exposed to the abortion pill. So it's either a green light or it's a red light. We're either successful about 63% of the time, or sadly, we're not successful some of the times. We use antidotes all the time in medicine. One of the most frequent antidotes we use is Narcan, because people make mistakes. They overdose on narcotics, most frequently fentanyl. So when somebody comes into the hospital or is in the emergency room or is in the street and they're unresponsive, the first thing we do is we give them Narcan. Narcan is available on Amazon. You don't even need a prescription, but it reverses a bad decision. The same thing with the reversal of the abortion pill. Moms have made the decision. They have immediate regrets on that decision, and it's our duty to meet their needs and to reverse the effect of the abortion pill, not only for the mom, but specifically for the baby.
I know you've shared before in this program some success stories. Do you have a story you'd like to share with our viewers?
Sure. I had a young lady who was facing the pressure of having an unplanned pregnancy, and she couldn't get the abortion pill here in the Pensacola region. So she actually drove all the way to Tallahassee, but they couldn't just work her in. So she ended up going all the way to Jacksonville, Florida. 5 hours from Pensacola. She got the abortion pill, and then she'd already taken it, and she started driving back on I-10. And she saw a billboard, and that first billboard said heartbeat at 18 days. And it kind of touched her heart. Then she kept on driving. She saw another billboard which said, "Your mom chose life, you should too." That was convincing enough for her that she pulled over at the next rest area, which was west of Tallahassee, and she looked up abortion pill antidote. That Google search took her to our website, abortionpillreversal.com. The nurse put her in touch with me. We called her in the antidote. She showed up to my office the following Monday, and we did an ultrasound, and we had a perfect baby with a heartbeat on the inside. We saw her a week later. We still had a perfect baby with a heartbeat. Months later, I had the privilege of delivering that baby, and she named that baby William, not after the dad, but after the guy who helped her save the baby's life.
Dr. William Lile, amazing. What an amazing story. And what an amazing, reversal of this woman who otherwise, she looks at this baby and she now realizes this baby could have been killed by this propaganda that she received. No wonder why places like New York and New Jersey are trying to stop this information from actually being presented to women, the abortion pill reversal protocol. So the abortionpillreversal.com is the website, correct?
Correct.
Abigail, I know you have met with people on Capitol Hill in the various agencies with regards to this issue. Tell us about some of the progress and also what can be done with this abortion pill going into the water. It seems to me that if, at least on this one issue, that there would be a restriction that you cannot have these abortions going into the toilets, into the drinking water, or to the water supply systems. That alone would stop virtually all of these chemical abortions because they're not being done in a brick and mortar facility.
Absolutely. And that's actually part of why we're advocating on this topic, why we're taking this environmental angle on the abortion drug. Because obviously we're all pro-life, but tragically, since Roe v. Wade was overturned, we've actually seen an increase in abortions. And so we need, as a movement, the pro-life movement, we need another route, another avenue. You know, Wilberforce ended the slave trade by putting flags on ships, the British flag on ships. That had nothing to do with slavery, but it ended slavery. We're saying, you know, when we're going to congressional offices, when we're going to federal agencies, we're saying you don't have to be pro-life to not want your water contaminated with chemical abortion, compounds. This is something that affects all of us. In particular, when you look at the infertility crisis in our nation, you know, Secretary Kennedy has promised to investigate the alarming increase in infertility by looking at things like endocrine disrupting chemicals. Well, endocrine disrupting chemicals is just a fancy way of saying something that disrupts your hormones. Progesterone is a hormone, and so if you're blocking it, you're disrupting the endocrine system. And so we're saying, Secretary Kennedy, we agree. Look at endocrine disrupting chemicals. Look at how they could affect infertility, including mifepristone. We're not saying that chemical abortion contamination in our water is causing infertility, but infertility is multifactorial, and so absolutely it could be contributing to infertility. So what can we do? We're saying when you talk to your members of Congress, when you talk to your local lawmakers, say, I want you to support legislation on this. There's in Congress right now, there's the Clean Water for All Life Act introduced by Representative Mary Miller. Urge your member of Congress to support that. You can go Liberty Counsel Action. We have a fax and petition on this. So become a subject matter expert. Learn about this topic. Learn about how it's contaminating our water. Educate yourself and educate others on this, because we really believe we would, just like you said, Matt, we can end chemical abortion by prohibiting the environmental contamination. So requiring, for example, women to go into a clinic is going to reduce abortions dramatically. Getting the pill, it's as easy as going on Amazon to get the abortion pill. If we make that harder, it will save lives.
None of this should go into our wastewater system. Certainly, human remains should never enter our wastewater system. Dr. Lile, what would you like to share with us in the remaining moments of Freedom Alive in terms of this issue and what people can do?
Sure. Well, this is a spiritual battle primarily. This is an attack on the image of God out of a hatred for God. And we are created in the image of God, not on our birthdays, but at that moment of conception. And one of the tools that we'll teach through our curriculum, which is available at prolifedoc.org, and we're doing a college and university tour, is ask patients, ask your colleagues, do you believe that patients have rights? We have patients' rights and patients' Bill of Rights in all 50 states. Then follow up with, should those laws apply to patients that weren't born in the United States? Well, now people get really indignant and say, absolutely, you better believe they do. Then say, I agree with you. And we need to apply those to the patients who weren't born in the United States yet. Because we are now diagnosing, treating, and curing babies in the womb. We are doing life-saving blood transfusions at 17 weeks, open heart surgery to remove tumors from babies, beating hearts at 27 weeks, where the baby has its own IV and its own anesthesiologist and is receiving pain medicine and a paralytic. We're doing vascular brain surgery, spina bifida corrective surgery, laser vascular surgery for twins. If we are doing all these procedures only for the life of the baby, then they are a patient. And a patient is a person, no matter how small. So yes, all true science will always defend God's preborn in the womb. So we need to understand this is a spiritual battle. We need to use our spiritual tools. We need to encourage our pastors to discuss this from the pulpit. And we even have a pastor's curriculum to equip them, because they are not being taught this in seminary. But true science will always defend God's preborn, whether it's the science of conception, fetal development, cell differentiation. It all says this is someone created in the image of God, and they have value.
I'll never forget that image of baby Samuel when baby Samuel was being operated in the womb, and that photographer, who at the time was pro-abortion, took this photograph of baby Samuel's hand stretching out through the opening in the uterus and grabbing the finger of the surgeon who was doing the surgery on baby Samuel. And now that young man is college age, may have already graduated from college. It's an amazing photo.
It is. It was taken by a friend of mine named Michael Clancy, and it was a surgery that was being performed at Vanderbilt University. I was speaking at Georgia Right to Life, and this young guy came strutting up to me, and he goes, "Dr. Lyle, you use my picture all the time." And it was 8-year-old Samuel Armas. And Samuel is now graduated from college. But I asked Samuel when he was 8 years old, I said, "Samuel, when you were inside of your mother's womb and that picture was taken," I said, "were you a patient?" He looked me in the eye without a doubt or a skip in his mind. He says, "Well, duh." Well, obviously, we are diagnosing, treating, and curing patients in the womb. All patients have rights, and they need to be defended. It's an attack on the image of God, and now it's a dangerous pill that is being shipped through the mail. If your daughter or your granddaughter has a cell phone, she has access to the abortion pill. It has turned not going to an abortion clinic, but the bedroom and the bathroom have now become an abortion clinic. And it might be done in your own home, and you wouldn't even know it.
Thank you, Dr. William Lyle, for joining us. Abigail Forman with Liberty Counsel Action. Thank you for your amazing and courageous work in this particular area.
It's an honor.
Thank you.
Matt, this is such a remarkably important issue. And what can we tell those at home, actions that they can take that will help get this pill off the market?
Well, I think one is obviously to be informed, and we have a very special, very unique website. It's very easy to understand, abortioninourwater.org, abortioninourwater.org. Abigail, who was our guest, prepared, along with others, a very detailed policy paper. So if you want more information, it's there. But there's also a PowerPoint. So you can take that PowerPoint, download it. You can show it to people in your church, Sunday school, your pastor, send it around, get it distributed far and wide. There's a lot of other information there as well. We not only have the FDA and the EPA in Washington, we also have state equivalents of those, and then local equivalents. Every community has a water treatment plant. Every entity across the country, every location should be interested in this. So start where you're best able. Share the information, get it out. I think it's shocking enough. People will take action.
What Matt just spoke about, please just think about actions that you can take to stop this. This is just so evil, and we can do things to make a difference. In closing, remember Psalm 127, verse 3, which says, "Children are a heritage from the Lord, offspring a reward from Him." Our freedom is a gift from our Creator. We must never forget that and always protect it. Join us here next time. You'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.